Hey everybody, Saul Marquez with the Health Matters podcast. I want to welcome you back to another episode recorded here at Health 2023 in Las Vegas. Today I have the privilege of hosting Dr. Byron Crowe. He's the Chief Medical Officer at Solera Health, a practicing internist at Beth Israel Deaconess Medical Center in Boston, and faculty member at Harvard Medical School. As an expert in digital health innovation and human-centered design, he oversees clinical program development for Solera's suite of physical, mental, and social health solutions available to millions of patients nationwide. Dr. Crowe, welcome.
Saul, it's great to be here. Thanks so much for having me.
It's a pleasure to have you here. And look, to begin with, I want to just start off by helping the listeners get to know you a little bit better. What is it that inspires your work in healthcare?
Many years ago when I was an undergrad, a pre-med undergrad, I was wondering what a career in medicine would look like. And I read a great book called The Checklist Manifesto, which many folks have read, Atul Gawande's famous book.
Awesome.
And that book and a few other great mentors in college pushed me to think more about this deep feeling I had that I wanted to work on health systems. Not take care of patients, yes, absolutely, and work on improving how we do care at scale. And that's been a theme for me for the last decade and a half. And it's taken me to all kinds of different avenues of healthcare, from quality and safety to high value care, and now into digital health transformation. But it's really anchored in this idea that we can improve health systems at scale. And if we do, we can make a tremendous impact on people, on society writ large. And I think that's been a really centering theme for me in my career.
Yeah, that's a really strong driving force. And Byron, when you say health systems, do you mean like healthcare systems or health systems in general, right?
Yeah, so I'm talking about systems of care.
Systems of care.
You think about all the different systems and processes that have to take place for us to get anything done in healthcare. And at every step of the way, there's something we probably could be doing a little better or even a lot better. And digging in and figuring out where we can make things run more efficiently, run smoothly, be more patient-centered, be more provider-centered. There's almost like endless opportunity to make change.
Awesome. Thank you for that. I just wanted to make sure we're looking at the systems that really connect care.
Exactly.
Yeah.
Exactly.
Yeah. The delivery of care, patient experience, everything.
Exactly. That large ecosystem.
That's fantastic. So a question for you, as a medical doctor, what makes chronic health conditions a space that's in need for further innovation?
Chronic conditions affect 6 out of 10 U.S. adults, and even more are affected by multiple chronic conditions where things get really complicated. Someone comes to us with 3 or 4 things that we as physicians need to manage longitudinally for years or decades at a time. You start to get into a lot of burden of keeping track of everything, both from the provider side, for sure, and then from the patient side. So it's hard to manage chronic conditions. If you manage them well, though, you can make a big impact on someone's long-term trajectory. If we can get someone's blood pressure under control, we know we're going to prevent strokes and heart attacks down the road. If we can get their chronic pain to a lower level, we know that we can get them more active, living a higher quality of life. There's a lot of chronic condition management out in the world, a lot of folks who need help with that. It's not easy. And we've for so long done it pretty much the same way. You go talk to your doctor, they evaluate you, they write you prescriptions, you get those prescriptions refilled, or you go see a subspecialist, and it's all on paper in person. I think we have a huge opportunity to reimagine how we actually make an impact on chronic disease through all of the other parts of our toolkit that have emerged in the last decade, from the growing digital health toolkit, now with new contemporary AI models and large language models. The toolkit's grown, and if we can start to move away from the legacy model, there's a lot of creativity that we can layer on top of what we already do to actually help people really manage their chronic condition effectively and without as much friction as we have today.
Yeah, no, I appreciate that, Byron. And just want to get an opportunity here to understand the value Solera Health offers to the healthcare ecosystem. How do you guys play a role in all of this?
We have a new platform called Halo, which is our next generation omni-condition management platform, bringing together our own curated network of digital health solutions with third-party contracted solutions all under one place. What that means is we can take the entire digital health ecosystem that a payer or an employer has and put it onto a single platform for a unified member experience.
Got it.
And a unified experience from the payer side in terms of managing operations, managing reporting, having transparency into outcomes. We put it all in one place so that this is the theme of Halo. We're starting to take all these previously disparate parts of the system and wrap around and hook into all of them, deeply integrating into them, and then bringing all that data and that entire experience into one place. So we're making linkages between the digital health ecosystem, linkages between the in-person system, linkages between payer and employer systems, all together so that it just gives us tremendous opportunity to, now that these things are all together, to really coordinate that care journey in a much more refined way than we could previously.
Yeah, thanks for that. I really appreciate better understanding. A lot of these solutions are point solutions. They're disjointed. It's a huge pain point for so many organizations.
Yes.
You want to make it work, put it all together. And it sounds like
Right.
that's exactly what you guys have here.
It's exactly what we've done in response to the needs of our payer and employer partners who have been dealing with this point solution fatigue now for years, but it's gotten so much more demanding even in the last couple of years after COVID. With the growth of the number of solutions, the complexity of managing multiple solutions, it's gotten overwhelming for them. And I don't think this is their burden to bear. I think they have tried their best to be innovators and move quickly in this space, but they need help. And that's where the Halo platform comes in, providing that technology solution to make it really easy for them to get their hands around this growing ecosystem, which isn't going away. It's gonna stay. And so if we can have something that we can continue to build and innovate upon, you can get the most of this system rather than having digital health stagnate in kind of this, in the ether, but never really come into its own.
Yeah. And what I really love about what you just highlighted, Byron, is that you're taking a look at this not only from a care provider perspective, getting patients what they need, but you're also looking at it from an operations lens and an economics lens to really bring forth a solution that could help with the business of healthcare, but also the providing of care side of healthcare.
Absolutely. Our platform helps patients, it helps providers, it helps payers, all in a slightly different angle. Obviously, when we can provide evidence-based solutions to patients, that's a big win for everyone, right? We're helping people improve their health, we're making them feel better. That's all very intuitive to everybody. But on the back end, when you can make it easier to run these programs, make it easier to manage them, make it easier to see what's working, what's not, we actually have a ton of impact on quality of care indirectly. If you make it really easy to manage these programs, you can manage more. That means you can offer more. You make it really easy to see what's working and what's not. You could do more experimentation, do more rapid cycle tests of change on your programs until you refine them to a point where they might have been performing well before, but now they're performing really well or as good as you think you can get it. So we can actually use some of these things that may not be so apparent, like operations, reporting, to actually drive downstream quality impact, which I think are going to be a really important thing in the next few years.
Yeah, that's the end game.
That's
right?
the end game. Yep.
Yeah, I love that. And so let's zoom in a little bit to the payers, right? Can you help me understand sort of the value add for payers with this?
Yeah, so from a payer perspective, they want a few things. So one is their employer clients really want to be able to offer often a more customized experience for members, or for employees rather. So if you're a large employer, you might have contracted with 5 or 10 of these solutions. You pick the ones that you really like, and some you may still like, some you may not, but either way, you want to have your customized network. And if you imagine trying to do a customized digital health network for hundreds of employers, it becomes totally impossible for a major payer to handle. What we've done with Halo is create the infrastructure to do that at scale. So being able to customize the network, we can bring our own. So if you want to bring in one of our curated networks, which we're very proud of, and it's a turnkey solution, you can stand it up pretty quickly. That's great. We'll put one of our curated networks in place. If you have your own contracted solutions, we can layer that on and customize the experience for your employers. So that's how we help payers work with their employer clients. And then in the fully insured book, we can work with payers to figure out how to curate the network so that it's making the most impact in their fully insured book of business. Payers are appropriately rigorous when evaluating solutions to go into their fully insured book. And not only do they want to know what the clinical ROI is going to be, but then be able to have transparency into those outcomes downstream and know that it's making a difference. So we do both parts of that. We do the upfront analysis on the expected clinical ROI. And then once the solution is live, we provide outcomes analysis and reporting back at the individual level because of how deeply we integrate with our network partners.
That's fantastic. Thanks for highlighting those areas. On the one hand, you offer scalability. On the other hand, reporting to make sure that everything's working. And that's such a seamless experience. How do you see Solera directly impacting your patients?
The first thing that we can do is just bring our network at scale to patients. It goes back to that point I was making earlier. When it's easy to do the right thing, it's easy to do the right thing. Mm-hmm. We can turn these networks on. We can get these solutions into the hands of people who need them faster. And then we can see the impact every day when we look at our outcomes. We're integrating deeply with our partners. We're measuring for clinically important improvements in health. So these are evidence-based biometric and psychometric measures of improvement. Things like, hey, if you have a musculoskeletal condition, did your pain score improve by 30%, which the clinical literature says, hey, that's a meaningful improvement if you get 30% or more. So we're measuring those outcomes at the individual level, and then we can see that. Oh, great. From this population, this percentage of folks got better. And it's very black and white and objective rather than numbers that might be too hard to interpret.
That's great. I appreciate you sharing that for sure. It's a very clear way that it impacts patients. And Byron, last question here. What is your call to action for the listeners, right? Like, this has been a fantastic conversation. And at the end of the day, health matters. And it matters when you take action. So what call to action would you have people take?
I think that for someone listening in, try and expand your idea of what's possible with digital health. So these programs are still very new, and we have a lot more to learn and a lot more to innovate, whether it's which programs to deploy, when, which populations to target, and how to link these programs more intentionally with in-person care. The next decade, I think, is going to be a tremendous learning opportunity for people who are invested in these solutions and using them and working with them every day. And for those who don't and say, you know what, we have a handful of these and we're good, they're going to miss out on all that learning and miss out on all that value creation down the road. So my call to action is think about how you can be using these digital health solutions and growing with them over the next decade.
Love it. That long-term, folks, is where your minds must be. And with solutions like Solera Health and the work of Dr. Byron Crowe and his team, the future's bright. So Byron, can't thank you enough for being with us today.
Hey, Saul, my pleasure. Thanks again.